everybody was just felt, how did we come to this? How did we get into a situation where we don't have that kind of cohesiveness in the society that a person would say something like that? Now, doubtless, her job may be insecure. Her insurance may be insecure. And it's regrettable that she says a thing like that, but that's where we are. So, when we have deep clefts in the society that bring about the kind of insecurity that we've got now, I don't think we can blame any group. What we need to do is to recognize that something is needed for the whole society that gets us back on track. Some people refer to these things, the remedies, as public goods. We need a public good in healthcare. A public good being something that everybody is going to want for everybody else in the society. Everybody is going to want that healthcare will be for everybody in the society. We need it in housing. We need some sort of guarantee that people are not going to have their homes taken away from them simply by the fact that they have been the victims of some sharp realtors and who have told them that they can afford the house. We need all sorts of public goods, and we have some of them. There many times people are trying to take them away from us, but we have fire stations, we have school systems, we have police forces, and when these things are functioning properly, they help to keep us joined with one another and to avoid making us fearful of one another. So leading toward a kind of social decline and collapse. Now, having said that, which is a kind of heavy message about where our society is and the need for moving to some sort of a public good for healthcare, let me go on to a rather different topic, and that is the kind of democracy that we have now in this country. I think that there's a very rough distinction between two kinds of democracy, and one of them I would call popular democracy, and the other I would call a corporatist type of democracy. In the popular democracy, the ideal situation is that the leaders pay attention to what people are saying. There is a dialogue among people by which they become informed and are allowed to make decisions that they can then transfer to their leaders as what they want. We've had debate going on since the time of Francis Perkins in the Roosevelt administration about single-payer health care. You cannot say that it is a debate which has just cropped up and that people don't know what's going on in relation to it. That kind of democratic debate that's been going on from Francis Perkins to the time Harry Truman introduced single-payer to the Congress, to the time that Edward Kennedy introduced single-payer in 1970 to the Congress, that has been happening time and time again. It is one of the long-standing wishes of the American people to have it. It was a majority issue the first time Harry Truman raised it, and the doctor said, that's the road to Stalinism. And if you're lucky, you'll find a radio program of Ronald Reagan when he was the propaganda man for General Electric, showing exactly how single-payer health care was going to lead to Stalinism. And it's a beautiful piece of rhetoric, totally wrong, of course, but that debate has been going on, and we now have a continuing majority for single payer in this country. Yet, it is neglected by our leadership. It is unrealistic. Why? We're never told. It is unrealistic because there is a corporatist element to our democracy, whereby we have a shadow government representing various interests in the country. We have a stream of organizations going through the White House earlier this year presenting President Obama with what they are going to do in order to avoid being held accountable to a law relating to health care. So we had the American Medical Association, the corporatist wing of the government as far as health care is concerned. We had the American insurance plans, the corporatist wing of our government having to do with health insurance. We had the SEIU, a union dedicated to avoiding single payer, in the White House talking with these other corporate interests. So we have these bodies that form a kind of shadow government, and to which our leaders are beholden. You've probably heard the figure that the pharmaceutical industry has now 2.3 lobbyists for every member of Congress. I don't know whether it's accurate or not, but it certainly sort of fits with the way things are happening in Washington right now. So this kind of corporatist type of democracy that we have is something that has led to important modifications in the original plan that Obama put forth. And we have, for example, on the issue of coverage. How many people will be covered? Well, the plan was supposed to be a plan for universal coverage. But now we're told that they will have to cut that back. And even in the House plan, which is more generous on this point, they will be left with something like 9 million uninsured. And in the Senate plan, they'll be left with something like 12 million uninsured out of the 45 or so million who are uninsured in the country. And this is before you start counting illegal, so-called, undocumented immigrants and legal immigrants who have not gone through a certain period of time since they were declared legal. So we no longer have the pretension of having universal health care associated with this legislation that's going through. The subsidies that are to be given to people by this bill, many people think are too small for people to be able to buy insurance. The idea in the plan is that you let the insurers sell the insurance to people